Welcome to this audio slides presentation. My name is Melissa Batchelor-Murphy, and I will be discussing a recent paper entitled Feasibility of a Web-Based Dementia Feeding Skills Training Program for Nursing Home Staff, published in Geriatric Nursing in May of 2015. As dementia progresses, older adults living with this condition become increasingly dependent on their caregivers to meet their nutritional needs. When language ability is lost, behavior is often the only form of communication they have to communicate any needs. Nursing home staff are not trained to deal with certain behaviors, such as clamping the mouth shut and turning the head away, and interpret these behaviors as resistance. Additionally, careful hand feeding is the current recommendation, yet training programs do not include information that there are 3 different hand feeding techniques that can be used: direct hand feeding, hand over hand feeding, and hand under hand feeding. If you would like more clarity about the different hand feeding techniques, you can go to YouTube and search for hand feeding techniques in dementia to see a video demonstration, or you can follow this direct link. The purpose of this study was to test feasibility of implementing a web-based dementia feeding skills training program. In addition to our feasibility questions, we were also interested in outcomes for the nursing home staff related to knowledge and self-efficacy, as well as the amount of time spent providing feeding assistance. The resident outcomes of interest were meal intake and the impact on feeding behaviors. The intervention was based on the current evidence-based guidelines, as well as incorporated the need-driven dementia-compromised behavior model for interpreting the different feeding behaviors as unmet needs rather than resistance to care. A problem-solving strategy of the C3P model was also presented, as well as the hand-feeding technique content. The study was conducted in 2 skilled nursing homes in the southeastern United States. Data were collected on the nursing home staff and residents at baseline, week 2, and week 8. Web-based data was collected on the nursing home staff's knowledge and self-efficacy as it related to providing feeding assistance. Meal observations were done, where the amount of time the nursing home staff spent was measured, meal intake of the resident was measured, and the Edinburgh Feeding Evaluation Scale in Dementia was used to measure feeding behaviors. Regarding feasibility, we were able to recruit similar numbers of nursing home staff and residents for the control and intervention group. We did not identify any major issues with our data collection tools. The study was designed for the meal observations to be conducted in the dining room. However, all of our enrolled residents were fed all meals in their bedrooms. Also, matching the enrolled nursing home staff to an enrolled resident proved very difficult. Data trends indicated that the nursing home staff and the intervention group did improve their knowledge and self-efficacy scores. During the meal observations, the feeding behaviors were increased in both groups. However, the intervention nursing home staff responded by increasing the amount of time they spent providing feeding assistance, and as a result, the meal intake increased for those residents. In the control group, the exact opposite occurred. There is only one other study to compare our results to, done in 2005 in Taiwan. One of the cultural differences is that the residents in this study were observed in a communal dining room, and the length of that face-to-face training was longer. Another consideration is that residents in nursing homes need to be recruited before the nursing home staff. In conclusion, meal observations in resident bedrooms and matching enrolled dyads was challenging. Web-based education is viable, but the coaching component needs improvement. The intervention nursing home staff and resident outcome data trended towards a positive impact, with more time spent providing feeding assistance and more food was consumed when nursing home staff were trained to respond to feeding behaviors as a form of communication of an unmet need. We also need evidence for the 3 hand feeding techniques to determine how and when to use each one. If you have any questions or comments, please feel free to email me. Also, you can follow me on Twitter. Thank you for your time and attention, and I hope you have a great day.